watch, share, and subscribe. We need you.
Hi guys, it's me, Dr. Lota, and today we're going to be talking about nursing homes. I get it. The word nursing and homes put together brings such a negative reaction in so many people because far too often we hear about go wrong, but we don't hear about the things that every single day nursing homes do for our residents that go right. Well, today I'm going to demystify that. And the question of the day is, are you going to end up in a nursing home? And if you ever do, how do you make the right decision about which one is right for you? So stay with me, watch this video through, and at the end, I'm going to leave a special tip that will make a difference in the lives of anyone, be it yourself or someone you love who ends up in a nursing home. Why do you want to listen to me? Because guess what? The past 18 years, I've dedicated my life to serving patients 65 and better who find themselves in long-term care nursing homes or coming for acute short-term rehab. And listen guys, sometimes, sad to say, some of my patients are less than 65, but they have chronic medical illnesses that can't be managed at home. And so they end up in one of our many facilities. Now I'm gonna show you two pictures. There's this picture and there's this one. One looks really swanky and the other one looks lived in. And the question for you is, which one are you gonna choose? Well, this isn't a trick question. The answer is, it depends. It depends on what you want, the things that matter to you. There is no right or wrong answer, but I am gonna help you navigate that path if you ever find yourself in it. So what is a nursing home exactly? A nursing home is a place for people who don't need to be in the hospital, but are not ready to be home because A, they're either too frail or they don't have adequate help at home. And so they end up in any number of different places, one of them being nursing homes. And you know what? Nursing homes now function like mini hospitals because right now there's a rush many times to get patients out of the hospital, and so they come into nursing homes. A lot of nursing homes have doctors on staff, nurse practitioners on staff, intense therapy, physical therapy, occupational therapy, speech therapy, and some of these nursing homes offer specialized on-site services. Some of them will have dialysis centers in the nursing homes. Some of them have vent units in the nursing homes, and some will have cardiac centers in the nursing home. So it's important that you do your research and find one that is going to fit whoever within your radius, be it yourself or someone you love who's going to end up in a nursing home, maybe for a short period, maybe for long-term care. So we're back to the original question. How likely is it that you or someone you love is going to end up in a nursing home? Well, guess what? With people living longer, I've seen patients in their 90s coming in for knee replacements, hip replacement, lumbar surgeries, and sometimes they can't go home, and so they will come into our facilities for short-term rehab. And then sometimes patients who are older have no one left to take care of them, and they will come in for long-term care. So if you live long enough, you might find yourself in a nursing home. So this video, regardless of your age, is made for you. So stay with us. So truth is, like everything, nursing home care is on a scale from poor care to excellent care. And what we're going to do today is demystify nursing homes. I'm going to tell you what to look for. I'm going to tell you what your insurance covers, and I'm going to help you navigate that journey if you ever end up in one. So the question is, who pays for nursing home care? Well, It depends. I know you're going to say that's my favorite answer, but truly, it depends on why you're in the nursing home. There are many different reasons to go into nursing homes. One could be long-term care, acute short-term rehab, respite care. And depending on why you're in the nursing home, you're going to have a different payer source. So if you're in for respite care, which is a 5-day continuous care for patients who are on hospice, to give the family a little leeway, maybe they're traveling, maybe there's something emergent that you need to be in the nursing home for. It's a 5-day period. Medicare will cover 100% of it. Now, if it's long-term care, well, there are 3 ways you're going to cover that. And the first one is Medicaid. And I'm going to give you some of the requirements, but I encourage you to go to their website, and we'll leave the link here so that you can make an informed decision on who's going to pay for your state, because it changes all the time. So if Medicaid is paying, some of the rules are age-based, 65 or better. If you're less than 65, then you have to have a qualifying medical diagnosis. And the other thing is income requirement and assets. If you're single, your income requirement is going to be less than $2,382 a month. And they're looking at your income and they're looking at your assets. If you're married, combined income is going to be less than $4,764 a month. Now, Medicaid will go back 5 years to look at your income, to look at your asset. So don't think you're going to be smart and try to dispose of income within that 5-year period when you find out, oh, I'm going to need to live in a long-term care setting, because that, A, they will find out, and B, it's going to come with things that may include booting you off Medicaid. So please go do the right thing. Medicare will not pay for long-term care. The other insurance that will pay for long-term care is if you've paid into long-term care insurance policy or private pay. And trust me, private pay, those bills can add up fast. Now, what about short-term rehab? If you're going in for short-term rehab, a variety of insurance plans will pay for it. I'm just going to focus on Medicare right now. So Medicare will pay for day 1 through 20, 100%. From day 21 to 100, your co-pay kicks in. And for nursing homes, for rehab centers, it's going to be anywhere from $170 or more a day. And that will be from day 21 to 100. And then anything after day 100, you're going to pay 100% of it. The reason this is important is I see a lot of times patients coming in and they or family members think, oh, I have Medicare, and Medicare is going to cover 100 days. Read the fine print. Medicare will cover 100% of the first 20 days, and day 21 to 100, you're going to be liable for copay, and anything after that, you'll pay the full amount. And the other things you need to know is it has to be a Medicare approved facility. You have to make sure you have days left in your benefit period. If you do not have days left in your benefit period, you will not qualify for those payments. So please talk with your social worker, listen to what they have to say, and ask the right questions. What are the predictors for nursing home placement? If you're a female, have a diagnosis of dementia, 85 or better, or widowhood. Those are the key indicators. It doesn't mean you may have all that and never end up in a nursing home. But by and large, a lot of patients who have these things going on in their lives may have a higher likelihood of ending up in a nursing home. Now, Nursing homes have evolved totally from what it was years ago. There are many reasons a person might end up in a nursing home. The most common is long-term care. 65% of patients in the nursing home are in there for long-term care. However, there are many other reasons such as short-term care, people that are post-surgery, they come in for rehab, patients who are going through chemotherapy, radiation therapy, too weak to be at home, will come in for that period of time. And then wound care, wounds are a huge one, IV antibiotics, and through it all, they'll be getting that treatment and will also get rehab for short-term rehab. Before going into a nursing home, it's important that you do your research. And I recommend that you go to the website, the Medicare.gov website. There's a list there that you can print out and take it with you. Look through it. There are a whole bunch of questions that you may not even be thinking about that you can ask when you go to the nursing homes. However, we're going to navigate through some of those questions today. So the first thing the first thing I would be interested in finding out is the nursing home Medicare certified? And there are many reasons that matters. One, if it's not Medicare certified, Medicare will not pay for you to be in there. And two, if it's Medicare certified, that means that that nursing home has passed a test by a government agency. And there are many different things that they look at. It doesn't mean that it's perfect, but it's a great starting point in your search for a nursing home. The second one will be the administrator and the nursing home. Do they have licenses for the state? And it seems such a no-brainer, but think about it. Would you go to get your hair done with a beautician that doesn't have a license? So it's really important that if you're thinking about your loved one, their health, where they're going to stay, that the nursing home and the administrator have a license for the state. Now, what about bed availability? That is key. If you go through your list and a nursing home has everything you ever wanted, but there's no bed, game over. They're not going to take you. There simply is no bed. So I would ask, do you guys have a bed available? And if the answer is yes, then you can dig in some more. What services, what specialized services do they offer? If you have a grandparent that has dementia, they are going to need a memory care unit. If you're looking for a nursing home, you want to make sure that they have a memory care unit, because if they don't, then why would you send them in if they don't have one? The star rating. The star rating goes from 1 to 5, and you can find out the star rating of the nursing home you're interested in on Medicare.gov. Star 1 means way below average performance. Star 5 means way above average performance. Why does this matter? Because if you're looking at a nursing home and it has a 1-star rating, then I would say don't bother. But if they have a 3-star rating, I would consider it, because then I would look at all the other things that matter to me and then marry that with a star rating. And then at that point, it's even important to talk with people that have been in that nursing home, who have had first-hand experience, and they can share some of what their experience is with you, and you can make an informed decision. What hospitals do they send their residents to, and why does it matter? If your grandma or your grandpa has been going to St. Mary's Hospital all their life, then you really want to consider a nursing home that will send their residents to St. Mary's Hospital. So that nursing home will have to be in proximity to their preferred hospital. If that doesn't matter to you, then that's okay. But if it matters to you, you want to look at the nursing home and look at their pattern of practice when they send patients out. The other thing you want to ask is care plan meetings. How often do they have care plan meetings? A care plan meeting is where the different disciplines sit down and discuss how patients are doing. And will they let you know when they have a care plan meeting so that you can attend or call in? Those are some of the questions you want to ask. Well, really important on the list is staff turnover. This is huge. If you're going into a facility where there's high staff turnover, I will be careful. And why do I say that? Because when there's high staff turnover, then there's less ownership of the patient. Think about it this way. If you have a guest at your home versus it's your home, when you walk into your home, you can tell, oh, this isn't in the right place. You know, I need to do this. But if it's a guest, depending on the guest, most times they may not notice those things because they're thinking it's a temporary arrangement. They're going to be leaving. The same thing with staff turnover. If it's an agency staff that is there more often than not, you're going to hear, oh, I don't know them. Oh, I don't know what their baseline is. But if it's a regular staff, guess what? They'll be calling you like, Mama didn't eat this morning. I don't know what's going on with her, but her appetite is less. And so they will know your mom well. What about language? Is your primary language spoken? If you're going into a nursing home for long-term care, for acute rehab, you want to make sure that you can communicate. If you go in there and they can't really speak your primary language, it can be very daunting. There are facilities that cater to specific groups of people. So look into that. If you're going in and your loved one speaks a specific language, to make it easier for them to do well and to acclimatize effectively, find a facility where there are more people that speak her primary language. What is their policy for use of restraints? Restraints could be medical or physical. Many times you're not going to see physical restraints being used, but you will see medical restraints being used. What do I mean by that? Well, your parent is more confused. Instead of trying to figure out why they're confused, sometimes it's easy to just put them on a medication that will make them a little drowsy. That is a form of chemical restraint. So you want to look in, ask those questions and find out for yourself. And then really there are things that are obvious. How do the residents look? If you come in and they constantly look unkempt and untidy, or there's an order and it's not once, it's not twice, every time you come in, there's just something there. Well, that's a warning sign. That's a red flag right there. You may have to move on and keep searching for that place that will be a better fit for you guys. It's important to understand many nursing homes may look glamorous on the outside, but it's a different story inside. So you gotta go beyond the outside, beyond the foyer, get in there, open up your eyes, ask questions, be intentional, use your sense of smell, and make an informed decision. What about seeing their primary doctor? Do they have a doctor on site? Are they able to go out and see their primary doctor? Those things matter. And even more importantly, if a patient has a problem in the facility or in the nursing home, how quickly do they evaluate patient? It's really important to know, do they have consistent staffing? Do they have a doctor on staff? Do they have a nurse practitioner that rounds? These are questions you have to be asking. If they're coming in for short-term rehab, how good is their rehab facility? Because that is really why you're there. How quickly are they going to see you? Will they see you the same day, the next day? How long are you going to have rehab? Is it a consistent time? Will they let your family visit? Those are things you need to know, questions you need to ask. Listen, guys, You don't want to be that difficult family, but it's really important that you advocate for the people you love. You want to speak up when you see things that aren't going right, and you also want to commend people when they're doing a great job. I've had situations where family members were really concerned about the ones they loved in a nursing home, and sometimes they will move them from one nursing home to another one to find the ideal fit. While that may not always be convenient, but if it's what you have to do to have a sense of peace about where the person you care about is, then go ahead and do it. In one instance, I had a lady who moved her mom from one facility to another facility because she felt that she was seeing bruises on her skin. When she got to the next facility, she still saw bruises. Eventually, she took her home and hired a private caregiver. And guess what? She still found bruises, and it turned out to be her skin was really, really frail. And it didn't matter how you moved her, it left marks. But you know what that did? It gave her a sense of peace because she had tried to do everything. And finally, when her mom came home, she realized, you know what? I did the right thing for her. At least now I know it's not someone abusing my mom in the nursing home. So you have to do what is right for you, what gives you peace of mind. So remember, I said I was going to give you one tip at the end, and the tip is this. The doctors matter, the nurses matter, the RNs, the LPNs, but you know who you really want to know? It's the CNAs. Why do I say that? The CNAs give the most intimate care to the one you love. Sometimes they're going to help them with eating. They're going to help them with taking showers, bed baths. And a lot of times, if there's open, good communication, they will be the first people to tell you when something is wrong. You don't know how many times I've gone into a facility and the CNA cop gives me a curbside and says, hey, Ms. V, I walked with her today and her urine smells a certain way. And then we find out there's a urinary tract infection. So if you have a CNA who is constantly assigned to the care of someone you love, make sure that you know them, that you treat them kindly, because they'll come back to give you information that you need to know at the right time. Listen, guys, being in a nursing home is not an ideal situation. No one wants to be there. We all want to be in our home. But if God has you there for whatever reason, that means you still have work to do. So in spite of where we find ourselves, we just want to always maintain an attitude of gratitude. If you've enjoyed this video, share it, leave a comment, leave a thumbs up. Thank you guys for watching, and be sure to check back for more. Take care, guys.